All right, trying to find where I can see myself here. All right, Amy with Momentum Physical Therapy. Just wanted to follow up on the stretching discussion I did last week. I got some questions on it and thought I should follow up. So I talked a little bit last week about stretching and patients that come in or clients that come in and say, I've been stretching and stretching and stretching every day, but my muscles still feel tight. I still can't bend over and touch my toes. And I talked about some of the reasons why that might be happening. So I gave the explanation or the demonstration of, say you roll your ankle stepping off a curb. You've stretched those muscles, those tendons and ligaments, and if anything, that joint should be a little bit more mobile, but sometimes people, that joint feels tighter, their ankle feels more stiff. And that could be because of several things. One, after that initial inflammation and swelling goes down, that could be due to that lack of strength and stability that your ankle is needing to feel strong and to feel stable. And what actually happens then is that your body can be bracing to protect itself, and the muscle, there's like increased tone in the muscles, if you will. So that joint is it actually feels more stiff, even though the range of motion of the joint itself may be increased. And also talked a little bit about how patients often come in and talk about foam rolling every single day, their IT bands, and they still noticed increase tightness of their quadriceps, so their hamstrings. They still have lateral or outside knee pain. And I talked a little bit about why that may be, and that if you are doing the same thing over and over and over and you're not noticing results, you're not seeing the change that you want to see, that it may be time to see a healthcare professional and see if there's something underlying or also going on that may be causing these muscles to feel or be tight, and how sometimes that can be a lack of strength that is causing this tightness or that feeling of tightness. I see this sometimes with patients with back pain, and I like to think about on the spectrum of flexibility. So on one end of the spectrum, I'm using hand motions here, but you can't see it. So at one end of the spectrum, you have people who are really mobile, really flexible, and they tend to lack a little bit of strength. That's not necessarily what they are genetically gifted at. Is what they have, their gift is mobility and flexibility. At the other end of the spectrum, you have people who are really strong and powerful and tend to not be quite as mobile. And what those people, to really have a balanced body, need is more mobility and flexibility. And what's interesting is that as humans, we tend to do the thing that we're already good at, or we tend to be drawn to the thing we're already good at. So those people who are really flexible and mobile, they're drawn to do more mobility work, more yoga, more stretching, and because they're already rather good at it and it feels good. Same thing with those people who are really strong and powerful. They tend to want to stick with more strength movements and do those things they're good at versus working on the mobility and flexibility aspects of their training. And one thing I've noticed anecdotally, there's not research to support this, but one thing I've noticed anecdotally is that people who are really mobile, just genetically flexible, mobile people, they often feel like their muscles are tight. And they may have hamstring length, they can bend themselves in half when they're lying on their back, what we call their straight leg raise. They can bring their leg almost up behind their head and they'll say, my hamstrings still feel really tight. And obviously hamstring tightness is not an issue for them because they have more hamstring tightness than they know, or excuse me, more hamstring length than they know what to do with. And what sometimes can be happening is that their nervous system or their body is craving that stability. And what can also be happening is that sometimes these people who are very, very mobile, they're not necessarily, they work on stretching and this mobility work, but they're not necessarily working then on using that range of motion in a loaded position, if you will. So it's one thing to work on stretching, and then it's another to then use that new range of motion in a functional movement is what we call it. So once you work on increasing the range of motion of a muscle, then using it and making it work harder or loading it into a weighted movement and not just working on the overall lengthening over and over and over. Because that's oftentimes, again, this is anecdotally what I've noticed in my clinical practice, is people working on stretching and stretching We're losing internet connection here. We'll see how this is working. We'll see if this works. I apologize for that. Where was I? Oh, yes. So if I notice, just anecdotally, like I said, that people who are stretching and stretching and stretching, and then the next day those muscles feel tight again. So they stretch and stretch and stretch. And they begin to notice a difference if we start adding in movements that load those motions. So after they stretch, then we use a weighted motion to really force the body to work harder and not just passively stretch, if that makes sense. So this whole topic of muscles feeling tight and stretching is a complex issue, and I've just talked about a few components of it. And again, maybe just thinking about on the spectrum of, are you someone who's really mobile and flexible just genetically, just how you were born, or are you someone who's more strong and powerful and typically not quite as flexible? And then thinking about what needs to happen for you to have that balanced body that is more resilient and can help prevent injuries. And that's really where physical therapists come in, is we can help you decrease the risk of injury by finding out where those limitations are. But just thinking about that as humans, we tend to be drawn to things we're already good at. So for someone who's strong and more powerful, a little less mobile, oftentimes we tend to be drawn to more strength-based movements because that's what we're good at. And we might need more mobility work to really balance our bodies out, and vice versa for someone who's really strong, or excuse me, really flexible and mobile. Hope you guys are having a great Tuesday, and if you have any questions, feel free to write them below, and we'll talk to you soon. Thanks.